Nuclear medicine. Nuclear medicine is a branch of medical imaging that uses small amounts of radioactive materials to diagnose and treat diseases. It involves the use of radiation to provide information about the functioning of organs and tissues in the body. In this process, radioactive materials are introduced into the body through injection, ingestion, or inhalation, and then tracked as they move through the body. One of the most commonly used nuclear medicine techniques is positron emission tomography, PET. PET scans use a special type of radioactive material called a radiotracer, which is injected into the patient's bloodstream. As the radiotracer travels through the body, it emits positrons, which are positively charged particles that interact with nearby electrons, producing gamma rays. These gamma rays are detected by a special camera, which creates a three-dimensional image of the body's internal organs and tissues. Another common nuclear medicine technique is single-photon emission computed tomography, SPECT. SPECT scans use a different type of radioactive material, which emits gamma rays directly. Similar to PET, the gamma rays are detected by a special camera, which creates a three-dimensional image of the body's internal organs and tissues. Nuclear medicine is used to diagnose and treat a wide variety of diseases, including cancer, heart disease, neurological disorders, and thyroid disorders. It is also used to evaluate the effectiveness of certain treatments, such as chemotherapy and radiation therapy. One advantage of nuclear medicine is that it can provide information about the functioning of organs and tissues, rather than just their structure. For example, a PET scan can show how well the heart is pumping blood, while a SPECT scan can show how well the thyroid gland is functioning. This information can help doctors make more accurate diagnoses and develop more effective treatment plans. What is the difference between radiology and nuclear medicine? Radiology and nuclear medicine are both medical specialties that use imaging technology to diagnose and treat diseases. However, there are some key differences between the two. Imaging technology used: radiology uses X-rays, ultrasound, magnetic resonance imaging, MRI, computed tomography, CT, and other technologies to create images of the body's internal structures. Nuclear medicine uses small amounts of radioactive material, called radiopharmaceuticals, to create images of the body's functions and processes. Type of information provided: radiology images provide detailed anatomical information, such as the structure of organs, bones, and tissues. Nuclear medicine images provide functional and metabolic information, such as how organs are functioning and how they are processing various substances. Applications: radiology is used for a wide range of applications, including diagnosing broken bones, detecting tumors, and monitoring the progression of diseases. Nuclear medicine is often used to diagnose and treat cancer, heart disease, and neurological disorders. Radiation exposure: radiology exposes patients to low levels of ionizing radiation, while nuclear medicine involves the use of higher levels of ionizing radiation. Treatment with nuclear medicine. Nuclear medicine can also be used for the treatment of certain diseases. In this case, instead of just using radiopharmaceuticals to create images of the body's functions, the radioactive materials are used to deliver targeted radiation therapy to specific areas of the body affected by disease. This type of treatment is called radionuclide therapy, and it can be used to treat various types of cancer, such as thyroid cancer and certain types of bone cancer. It can also be used to treat non-cancerous conditions, such as hyperthyroidism and some types of arthritis. During radionuclide therapy, the patient is given a radiopharmaceutical that specifically targets the diseased cells or tissues. The radiation from the radiopharmaceutical then damages or destroys the diseased cells, while sparing the healthy ones. Overall, nuclear medicine is a versatile medical specialty that can be used for both diagnosis and treatment of various diseases. However, nuclear medicine does involve exposure to radiation, which can be a concern for some patients. The amount of radiation exposure is typically very small, but it is important to discuss any concerns with your doctor. Additionally, patients who are pregnant or breastfeeding should let their doctors know before undergoing any nuclear medicine procedures. Thanks for watching.